So if you, after we get done
I've seen
here,
a lot of you guys.
if there's a moment you say, oh, I have a question.
So we're
What are our
gonna
resources
try to
we
go
to?
mostly over the
Right up here,
non-invasive
we've got 800
capabilities
numbers.
for the
We've
980
got
that you
customer
already
clinical
have,
and
that you could
clinical
already be
support
using, and
24/7.
could hopefully
Yes.
simplify what you're
Work-
currently
work-
doing,
work- work well?
and things like that, and help kind of avoid needing
Okay.
to grab other
So
equipment and
just so
stuff
you
like
got
that.
our
There's a
keys
lot of
right
times that
at the
this would
phone
actually be a
right
lot
there. You don't
easier.
get, it's not like a long
Pulling another
transfer
V60
process.
or do
They're ready
something
for
like
the
that.
call. So
So-
as I said, some students were just getting assigned to this, said, "Ooh, I have a
Do all of
question."
our machines have NIV on
So
it?
always remember, 800 number on
Yeah,
top.
the
We've got some
non-invasive
other
is a
resources as
standard
well.
feature on all
They gave me
980s. There's
pediatric
nothing extra.
information.
There's some extra things beyond that, but adult
Yeah, so
non-invasive, yeah.
the FDA approved for use of this is on Linux.
The only thing that's
Am I aware
different
that
about
hospitals
doing
use
this
this in
on the
other
980
locations?
versus the
Yes.
V60
That's a different
is,
department, that's
you know,
the
there's
clinical team, our
two
medical liaison
students
team.
instead of
We'll
one,
still
right?
ask questions
So we
just
need that
So same circuit,
Same
It's not on the
yep.
page.
non-vented
Channel
mask,
through here,
And
we'll
non-vented
ask
mask.
the question as best we can. It's just functioning, I have to stay kind of on.
So you guys have an assortment of, well, not an assortment, you have masks, we have the blue elbows, which are these ones here.
okay.
So that blue elbow, that's the difference, is that there's just no vent at all.
Oh,
That's all it is. And literally, it's pretty simple. There's a lot of different masks on the market. The mask with the numbers, like a 1 or 2, those are just link sizes for the V60 mask in a single limb circuit scenario. This is actually a non-vent one. So just look for one that has totally no holes, no nothing. Blues for this manufacturer, they're not always blue. But your guys' are blue. So very easy. And it should just pop right in. So you should be able to take off on another mask. You can just take off whatever the elbow is and pop this one. So if you have that, then you're good. The reason we want a non-vented mask is because you have an exhalation side here. That's it. You have an exhalation side and inspiratory side, so we're utilizing that. We're just not used to that because we're also used to doing the V60 and everything else. So that's the one big change.
Okay.
Everything else,
And I was looking for a lower FiO2 option.
we'd be, it's
So
the
I
option.
cleared it, so
Oh,
I
is it?
put this flow meter to 20 liters a minute.
Oh,
And I
yeah.
changed my flow on the high flow to 20 liters a minute.
So everything else on here is gonna be
I
pretty
feel
simple,
like-
non-invasive on this
I mean,
machine.
we're
It's
using low flow
nice.
tubing.
The things that are the
Then with the
most,
lower FiO2, that would be 100%.
I guess, confusing is that
I think Kevin would be.
you have a lot of options.
That's
That's really the problem,
Let's get you
right?
right.
On our
Thanks for
V60,
letting
we
me
only
know.
have a couple options. We turn it on, we have ST, we have a couple other
So,
modes we can do.
We have a
There's a
manual
lot of
back
things
here,
we
this
can do
one's
on this.
maybe floating
Basic
around here, I don't see
SIMB,
it. We have a
straight
manual with the
spontaneous,
pictures,
it's
so if you're
all
kind of stuck
non-invasive.
in a moment, and want
Actually
to
gives
check
us
something,
more
remember, we've
choices.
got the manuals right
So if you
behind
really did have a
We've got
patient
your
that
800
you have
numbers, we've got
extubated
some
and is
resources.
doing very
On our
well,
website, on
post-heart patient or something like that, I like the option of just straight spontaneous because I could do a true just 10 over 5. And so that's kind of a nice deal. I don't have to put a rate on there.
So, what my
A
mission
lot of
here today
patients
is
is
to
a
kind
lot
of take us
nicer.
through the setup, do the settings and
So
all
let's
that.
say we wanted to
Some of
do
you are
something
probably-
like that.
This is kind of things you've already heard, but certainly ask any questions if you might have.
There we go. Hopefully that'll stop.
So first thing I do when I'm setting up the DSIR Plus, is I
So
want to make sure my cylinder goes. Thank you.
when we hook it up, the one
make sure
thing
my
you need to
cylinder-
remember when you're doing this though, sure, everything works great there,
It hasn't, the drug hasn't expired.
but remember this is
And I
an
also wanna make sure
invasive
that it does
ventilator
say final
first.
on it. I just want to double check.
So the
that
trigger and all that is built very, very
So I can kinda
sensitive for
check that
invasive
box.
kind of scenario. This is really great. It's a super great trigger. However, when we're
Next
doing
thing I'm gonna do is I'm
non-invasive
gonna
stuff,
put on-
that trigger becomes very, very sensitive. So I find the best thing to do is just to turn up that sensitivity. So if we're defaulting to 3,
And I'm
I
just
might go
gonna
to
hand
8 or
tighten
10 to
onto
start
the
with.
cylinder.
When I play with that, that seems to 60 and other platforms that are non-invasive units first, they combine a lot of things, they ignore a lot of things, they make things very difficult to trigger just because it smooths the
Item
process
lever
out,
on top,
makes it
I
a little
open it
easier.
all the way,
People are
I close it. and
leaking
then I
a
wanna make
ton,
sure I have
lots
the
of other
proper
things
pressure.
going on.
And then
So
open it.
right off the bat, I just turn my sensitivity
Close
way
it.
up, and you can turn it down and all that, but if we just think in that term,
When it comes to cylinders, I
Then we'll
don't
kinda
ever
get in a
probably
good
want to
place.
use a cylinder.
The other
that's
part
less
of
than
this,
500 PSI. It's time to change it
because
out.
we're
That way you're not
using
charged.
this non-invasive in the system that's built as a leak sync system,
We
right?
also
It's built
recommend,
first for
changing
leaks, so
out
there's a
200
default scenario that it pops into initially. in more settings,
Next step is I'm gonna take the little
it's
hose
gonna
coming from
default
the
to 40
regulator.
liters. So that currently, this is the largest leak that we can manage is a 40-liter leak.
I'm gonna put it.
It's a pretty good sized leak. But if you have a full face mask and you got a good sized leak, 40 liters is easy. You can blow right past that.
Notice there's
So if
only
you
one.
get
in
larger
use,
than a 40-liter
You never
leak, it's gonna say
plug two
disconnect
in
and it's
at the
gonna do
same
all that
time.
stuff and it's gonna make it
Unless we're
annoying.
doing that switch over. of the
So that's the
system.
next thing I tell people to
there's
do.
always only
First,
one
change
cylinder.
that trigger up, next go straight to here and turn this all the way up to its max of 65.
Once I have that, I'm gonna check my other connections back here.
That max of
I
65
have
is
a-
more than the
I have a
V60
blender
can
truck,
do.
that's one of my backup
This V60
systems.
can only do
Notice this
60, and
white
so
quick
that
connect
should
panel.
be very
I wanna
close
make
to
sure
the
that's
capabilities of
connected.
our V60s. So this is
Secure
getting
it
us
on the back.
closer to what we're used to.
Sometimes when you deliver
So
equipment,
turn up
the
that
drivers
disconnect
don't do this
sensitivity
for you,
and
so
then
just be
turn up
aware
the
you wanna double check
trigger.
these initial connections.
Make sense?
Once they're connected, I don't, you know, you don't need.
So from there, we should be good to go.
The other
We
connection
should
is,
just be able to do all the same
so the
stuff.
cylinder actually talks, it has two-way
So right
communication with a
now-
transceiver mounted above it. So it's double checking the concentration, it's double checking the expiration date, even though I asked you all to do that, it's also doing that behind the scenes. So there's a black cable, I just wanna make sure that black cable
It's
is
just
connected.
no air supply.
Should have.
Yeah, this is the one with the.
And then I have my
There we go.
Take a minute.
blender oxygen hose to my high pressure oxygen source.
So,
Wanna make sure
let's
that's
try
all
it.
connected up, and those are pretty
I'll do it.
initial connections.
I've already done it.
So let's take a look at the front of the device. So I turned it on, and it went through its little self check. There's also a previous checkout to get it ready, which some of you may be familiar with. Oh, I'm sorry. All tied up here.
Okay. Now we're just on 5/3, so super low. Not bad.
So
Give
what
her
we're
a couple
looking at is
minutes,
the front
she'll
of the
pass
device.
out
I've
on
got-
this.
I've got my
Big old
injector
deep
module
breaths.
here. I've got my injector module.
Right. Somebody stand by.
It goes to our injector module. Got my main power indicator. Green means it's plugged in. Whenever it's
Trigger doesn't
in
sound
use,
too
I
bad.
recommend please always keep it plugged in.
Working a
Need it
little
on
bit maybe,
transport,
right?
It's fully charged with battery good for up to 6 hours. I've got integrated pneumatic backup, which we'll go over in a moment. That's one of our backup systems. So of course, you never want to abruptly discontinue carbon dioxide, so we have some backup systems to go into. Got our control knob where we rotate and confirm our menu choices. And then of course, we've got our sample.
Not bad.
So,
Okay, the other part of
on the
this,
sample line,
the compressor is working pretty hard, right?
we have a filter on the sample lines. They're good for-
Note on that,
If you're using,
that compressor will only generate about
You have something going through it,
35
you wanna change
liters
it
of
up.
performance. So we said that we can manage a 65-liter
And those
leak on
are-
a ventilator, but just if you're unplugged
Those
from
are all
everything,
we're
you're just on the wall, anything over 35 liters, and it's really pushing
So
it.
then go back up to the
So
main
it'll
screen
try to
here.
do it, but you might get have some performance issues. So most of the time it'll be plugged
is our
into everything,
display.
so it should be fine.
We've got the
But for
Inomax
this purposes,
cylinders.
just remember.
Notice how the cylinders are here right now.
That's pretty good. It lasted a long time.
Just doing some exercises.
It'll turn green. That tells me my cylinder valve's open. One quick mechanism to do is check.
All right.
This is where we set our NO dose. We select, rotate, set our dose, and say 20 parts per million.
Any questions?
We press it, and it confirms the dose. Of course, it's alarming if anyone has the drug into the drug. This shows the schematic of the patient getting the drug. Down here on the bottom right is our patient information.
Ambulance
button.
to room 30
If you want
now.
patient information, you could-
Ambulance to 30 now.
Good. Select and put in your patient
Okay.
information. This is our monitor area above here. So when I first set a dose, the alarm limits for NO would be 50% above the set dose and 50%.
Was it not connected?
Automatic. The first time I set my dose,
Oh.
I go change my dose, maybe on a meeting later. You need to manually select, rotate, whatever your alarm limits you want. Protocol is
Do you have a question?
No, I'm sorry, the fan was.
Oh, you were enjoying.
So my goal when we start to talk about stuff like this is I want it to make sense. Why we do the things we need to do on this ventilator. And usually if we tell that story of this is what the ventilator is trying to accomplish, this is how you're trying to accomplish it, this is how we kind of get it there. Otherwise it doesn't make sense. If we talk about the trigger and that trigger is an invasive trigger, so turning that way up actually helps smooth things out quite a bit. Otherwise, you do end up getting a lot of false triggers, a lot of stutters, a lot of things like that.
I think that's the one that I forgot to hit. Because I was definitely getting auto trigger when I was playing with it on myself before you. So
I had the same issue when I play with it. Like even on exhalation, it was trying to trigger. So I think just every little bobble, even your exhalation, if it's in that scenario, you'll get a trigger because that trigger is set very, very sensitive. Invasively, it's great, but non-invasively, it changes those flow characters. So that's one thing to see. Let's try this again.
So now it doesn't know that the
So,
cylinder's actually. The patient
Usually
is
the
still
way I
getting
think
iron
about
max,
this
right?
too, I think about this in
So
my RT brain, okay, how would I do this? I would be probably doing this on, let's say, my cardiac patient like we started out.
So in this
He's
case,
doing very well, I'm ready to extubate, so I'm gonna come over here and do my extubation stuff anyways, right? So I'm gonna kind of do my first support, do all that kind of good stuff. And so if I'm gonna do that, I'm gonna stand by. So you'll already be in standby, which is nice.
if I remove,
That helps you, gives you time to pull this out, pull your mask out, put it in standby, do your extubation.
now
Then
let's
you
say
can
I
nicely
walk
come
away
in
from
here and
bedside
do that.
maybe
What
a
you
year
can
and
actually
say,
do, and I think
device is
about
alarming,
doing, I haven't done it a
it's
ton,
not
so
now,
I only
what
spent
happened?
about a year with this
On the top
ventilator,
left, you have
actually
two
in the
alarm
clinical
bells.
setting.
Those are your
before that.
recent alarm history. But the one that kind of.
But I would put it on, I would match very closely the settings that
And
I
it
have
tells me
when I
what
extubate.
time, date, and what type of alarm.
So I can get
I have
most of
two
those
high
exact
priority
same
red
settings
and one
non-invasively.
lower priority in yellow.
I would just try to match that.
Sample line filter blocks.
His volumes are in the 500s, and he
Once
was
I review
on,
that, if I'd like, I can go
maybe
ahead
he
and
was on
declare it.
some kind of
So
a
now the alarm bell
DC
icon
Plus or
has
something like that where he could do
trash
his
can
own
with
press
it.
and trigger his own stuff.
You just clear it.
Then you
There
could
is
maybe go
another
to an
area that
SIMV,
holds
or if he was
the
just
alarm
on a
history.
spontaneous mode
That's your
anyways,
temporary alarm just for you
doing
to
his
decide,
his
so you know what's going on.
trial, then I would just leave him there. Do him on the same thing.
If I
Right?
go over here to the right
Let's
side,
put him on 8/5 or 8/3.
this is my settings
Start it
menu.
right there. So that would
So in here I've
potentially
got
be
6 menu
very
choices.
close to what he was
Preview,
just
check
doing,
out,
just
and
without
auto
that
purge.
done
Notice
too.
they're grayed out. That's
So
because
I
have
think
a
this
ghost
gives
set,
you
so
a
it thinks
great-
it's on a patient. Those are
another great
previous
tool
procedures
in your
that you normally would do on a patient. Now,
So
alarm history, remember how I talked about alarm history earlier? So if I want to go in, let's see a little bit longer for however long it's on the patient. The only way you can clear.
your apnea, then of course we can go and set all that kind of stuff up, but that's going to be very similar to, and another added benefit of the V60. The V60 we had to put a backup rate in because it did backup rates and apnea stuff different than an invasive ventilator did. So here we can just put our apnea settings in, put your step straight to the fine. I think some kind of a protocol helps. I'm
calibration.
sure you guys will
So
kind
the
of
nice
work
thing
on
about
that,
this
get a
device is
simple
when you
place
first
to
turn it
start.
on, it calibrates itself.
It's one of those things you're just going to play with.
So I mean, if we're going from a patient, let's say our cardiac patient comes up, we're already gonna have a backup rate in there. And so if we switch it over, I mean, it'll be there still.
Yep.
If you ever are off troubleshooting with a
Yes.
customer service or
Check
technical
it and
support,
see, double check.
they ask
Sometimes
you,
it does some
hey,
changes
to
if
resolve
you've
that
done other
problem,
things in other modes, but yeah, it should all still be the same apnea rate,
That's where I
apnea
would
interval,
go into
everything
the
should be the
settings
same.
menu. Doing a low calibration right now. And then you could just manually say, gosh,
That's about it.
And we'll just flatly go. Now, in low calibration, because it's
Too
a part
easy?
of the monitoring function, you can still be.
Easy.
delivering
Easy as pie, easy as mud,
Now
clear
we
as
know the
mud.
two things
It's
to,
easy if we use
up
it.
when we put somebody on NIV. When they're having trach, or whatever reasons that we're finding that they need to be on a different.
Right.
Is this similar on the Draeger? The same sensitivity settings? Is that, because on the Draeger we have a NIV too,
Right.
but how is that?
I was thinking your sensitivity on the Draeger I thought was backwards from this one. I thought on the Draeger, when you turn the sensitivity up, it's more sensitive. On this one, it's sorry, yeah, it's less sensitive on this one. So, because it's gonna default to a flow trigger. So it's saying the higher that number is, the more flow it's gonna take to trigger. So it's actually
If it's above in the yellow
I
area
know the
above,
Europeans think differently.
They are a different
We
group.
do.
got to spend some time in their lab over there.
and
It's different.
the yellow would be under delivering.
So yes, that's a great point too. I can't remember. I talked
So
to
is there
somebody
any
about
other
that.
nuances to the Draeger?
But you are
for
still
the
doing
NIV
some
mode?
NMX work.
Yeah. I'm
Just
just
gonna be
wondering.
Can I ask a
We've got our light button,
mechanics question?
so you can change the
So I
screen
know
color.
on the invasive
screen
mode we can
brightness
do
setting.
NIFs. Is there a best practice
You've
of
got your
doing
alarm.
the
You can't
NIF
turn it all
on
the way
the
out, but you
Puritan
can turn it
Bennett
down, maybe in the
so
NICU
we can
where
have
adult healthcare,
something
we want a little quieter.
across the
You can set
board
it anywhere from 1
to
to 5 for the
follow
loudness of the
and not
alarm.
have everyone do it differently?
And then
Depends how
lastly, we
everyone's
have our
doing
clock.
it. If
So
there's
this doesn't know-
Well, that's why
I-
I'm just wondering if there's
So
a
you can
best
just go in there,
practice,
there's no
because I haven't been able to
password,
find
no one
anything about it.
Yeah.
Just
That's-
simply select,
this is
rotate,
for a NIF.
and confirm.
Well, I'll just work through how I do a NIF on this.
Exactly.
That's definitely,
And then back
I
out of
like
those
the NIF on
menus,
this
up
compared
here
to a
in
lot
the
of other
screens,
things that do NIFs.
I can get back to my end screen. And it's still going through its low calibration. Any questions on
Rip
the
my
settings?
lung out of my bag so we can actually do this thing on.
So, part of the setup process is of course pre-use checkout. So pre-use checkout, once you do the process, it's good for 24 hours. So in other words, if you go through
It's alright, that
pre-use
circuit's
checkout,
not
that's
going on a
when you
patient.
finish. The last thing you want to do is standby. You can either leave the screen on, set it aside, or turn it off, but you're still good for 24
Okay.
hours. It doesn't know that it's 24 hours.
There's a couple
You
of
have
ways to
do
allow
a
you guys
little
to know.
note, little sticky, hey, I did this at this time. It's gonna come back, sometimes you can race up
So-
and say we want INOMAX now.
In a modality like this, so if I'm in BC Plus and here's my volume and everything, I can do my NIF is what I like to do on here, and the thing that's different about the NIF on this that I like is that we're just gonna push and hold, right? We're gonna hold it until he gives us
So I'll
a good
walk through a
effort.
pre-use checkout.
We're gonna see
Actually,
that
let me
effort on
jump
the
around here a little
screen.
bit first and go to backup system.
20 seconds is the longest we can
So
hold that
if there
before
is
manually,
a
that's it, so you
mechanical issue
can't
with the device,
totally choke that guy
something
out,
where
but you
do
can do a
definitely
nice
need
long
to
hold
come through,
until
where
you
you'll
see
know
that
it's not
appropriate
being
thing.
delivered, you say, hey, I wanna troubleshoot.
The good thing is you can do it in a
backup
lot of
modes. You have two.
modes, you don't have to be in a
Integrated
spontaneous
backup.
mode,
Once
because it
you
just
flip the
needs the
switch,
patient in a,
stick
some
it
kind
down
of a
the flow
flow
of the
cycle
vent.
breath so it can take his own
250,
breath in there and adjust
milliliters
the
of
flow.
flow, 800
So
parts per million
once I
INOMAX,
do that,
injected into the
so
circuit.
I
So it's
like the
dependent on your
spontaneous
flow.
mode myself, that's however your protocol goes, but a spontaneous mode means that he can actually do a nice,
When you
breath
switch
without
that over-
interrupted breath. in the
How
middle.
many parts per million did you say?
But in a spontaneous mode, I can push and hold that, wait until I like what I see it on the top up here. If I'm happy with it,
If you wanna know what
I'll
your
accept
dose
it.
is
Obviously,
then,
if we
because
saw
again,
three,
depending on
negative
flow, we
three,
have a little
I would say
calculation
I'm not
tool.
happy with that, and
You've
I
got your
wouldn't
backup,
accept it,
your
and then it
graph
doesn't
for
log it.
estimated backup, but there's
In my
also
opinion, the
calculation,
most
200
important thing
divided
for
by
me is
12
that
will tell you what your
it got a
dose is.
decent number, and then I locked it and accepted it and logged it. That said, the clinician approved that effort with that patient. So now we can go back and track that and say, oh,
Again, we
here's
wanna make
what
sure
the
we don't interrupt
approved
this
NIFs
continues,
have
so we wanna
been
make sure we have
for this guy over
backup
the last 2
systems
days or
available
whatever.
immediately.
So that's kind of the things I think about as far as a technique and how to do it.
Well, I just have seen people who want to coach the person
That's
through
gonna
it
be
like
up
they're
to
doing
your-
a manual
your
NIF,
protocol.
but is
Um,
that a skewed result, whether you're just holding them, say, we're gonna cut your air off for a minute, just breathe as hard as you can. So that's the one thing I'm asking.
I would say that without
So,
making a clinical
that's one way to do it. So the other
decision
way
for you guys.
is your INO blender.
That's a judgment
Okay,
call
this
for
way
the
you have a little
evaluation
more
team for
control.
sure.
You
I
say, okay,
I used to like
I
to
know
coach
my
every
dose,
once in a
let's say, is
while,
20
but
parts per million.
yeah,
Down my
you could
flow,
say that it might skew
anywhere
the
from
results a
5
little
to
bit.
14
Even if I
liters.
coach a patient though, if they
Except
do not
on
have the strength, they don't have the
dose.
strength. It's-
Kind of a
and
stiff
if you
button,
feel
just
like
know it's
I've
supposed to
gotten the
be
best
firm so
number
it
for
doesn't get,
that patient,
accidentally,
but I think that also is good
Right.
to do when you, if you've accepted those numbers.
Why am I about to
and you
faint?
felt
Oh
like
yeah, I
that
stopped
was
breathing.
an honest number to give that versus Tim or versus Christy or
Nice thing
anybody
about
else or
this also
Samantha,
for your
maybe they're
NICU nurses or
wildly
nursing staff is,
differentiated, and then you guys could say, oh, wait a minute.
It's not
there
dependent
could
on
be a
flow now.
difference.
Whatever dose you put in there, as long as you
Yeah,
have
it's a
flow,
good question.
you're gonna
And
get
I
that
think
dose.
I just didn't know if there had been
You
studies
said
done.
5 to 10 liters to put it on?
No.
I'm not aware of a
The
paper that
5
I
to
know of
14
that I
is the
can
range
refer
you
to.
can.
Okay.
Yeah, that's.
I think on a vent though, coaching is less of a parameter than it would you would if you were using a manometer, because they're stuck with a closed circuit tube in their airway, so they have nothing left to do but take the biggest breath they probably
So once you
possibly
would-
can.
They said everyone's talked about it
Solve your
doing it
issue?
differently.
Yeah.
So that's why I was testing.
Sure.
In their eyes.
Yeah.
Just wait for the look of fear, and then you know you're doing a good job.
It's kind of my favorite time to do that, just, especially in a spontaneous mode. I see him exhale totally, and I push my hold.
I mean, what happens if you try to hold your breath too long and you're walking up and you go,
Yeah.
Okay, I solved that.
do it.
I bet there's a good study on that, but I have not seen one of them.
Everything is.
I'll see what I can find.
Yeah.
In this case.
It's a good comment about the intubated versus
So that's the
non-intubated
neck back.
spirometry.
Again, it's 250 milliliters per minute, depending on the flow.
Because yeah, it's pretty easy.
Calculation is 200 divided
Not
by
getting
flow,
any
and
breath,
then
you're
what's
only
parts per million.
Give it good effort.
Mhm.
Very short.
Other option, rhino blend. Set the exact dose that you need.
Anything else?
Flow range is anywhere from 5
So that's
to
a
14,
good
whatever
thing
you
about
want to set
though,
there.
about the dragger versus
But it's not
this and
dependent on flow.
the
Whatever it
triggers,
is,
the
put on
numbers,
flow.
the way those things go. If you guys find that you're bumping up against things that
Any questions on that part?
seem to be issues here, it could be for some of those reasons. The dragger, what I'm used to, operates like this, and I assumed it would operate the same. This one just doesn't seem to do that very well. It could be that this is just
Yes,
a
freeze.
difference. So if you guys have questions like that, shoot
The
those
locale will
questions
be
to
done on
Christy
that.
or myself. I don't
So in
care
the
if you
background, when I
text,
first
say,
turn it
this
on,
vent
it'll
seems
do
like it's
both
junk.
the low calibration. I can still do
And I can
everything
talk about it.
I need to do, it's just how quietly do it in the background.
That thing
It's
about
part
the
of the
leak
monitoring
sync
channel,
is
so it's
very
not gonna
true.
affect your-
You mentioned the trachs as well. When I have a trach patient that's a good sized adult patient, maybe if it's maybe an older trach that's had it for a while, it's got a pretty good leak, a Cuffy's trach or something, I'll make sure I definitely check this leak sync once I'm enabled and make sure that my leak is not higher than I think it is. If my leak is down at a 10 or something, if I have this turned down to a 10 and I'm leaking 25, well, yeah, it's going to be very difficult for that trach. So I want to check that and make sure that I'm capturing and able to handle whatever leak is going on with that trach patient as well. So this comes into play quite a bit when you're dealing with leaks and stuff.
High calibration is a little
Always like to
different.
check
That's using O2, NO2, and NO. Hospital supplies the O2. We should have little green little cylinders of NO2 and NO, and that's where we do
Huh?
high
That's what I thought.
calibration. Have you ever
Yeah.
done a high
Nothing
calibration?
else? You guys good?
Good.
Yeah, I think the NIV stuff's kind of.
The one thing you might add,
covering that, correct?
the difference between 5/5 on this compared to
Okay.
10/5 on a V60.
So
So
they have some cylinders. and
on your
basically
V60,
they're
everything's measured above zero.
30 days.
So 10/5 is 5 above 0 and 10 above 0. This is using a pressure support. So 5/5 is actually the same as 10/5 on our V60. So just so you guys can relate that.
And 721
Yeah, so
for
in
NO.
an
Doesn't all
ICU
have to be done
style
together. Obviously,
ventilator,
someone's on top of it,
ventilators that
making
are
sure
acute
it's
care
done.
ventilators, they are PEEP compensated. I just say ventilators are because there aren't any modern ventilators right now that are not PEEP compensated. They're all PEEP compensated. Non-invasive devices typically are not, so they will go off of whatever I set for my support. Whatever I set for my PEEP, everything's set.
So auto purge,
at the
what are we
ventilator.
doing when we press auto purge?
So when I set
Making
a
sure there's
support
no
level
static
of
gap,
5 on
right?
this
I'm
machine,
sitting here
then it's
flipping
5
around the dials
above
with
peak.
you and not paying
So you'll see
attention.
those peak pressure numbers, they'll say 10.
Yeah, just a little bit actually.
That is a
If I go
difference.
ahead and
Now,
auto
that'll
purge,
correlate when you're in non-invasive or invasive. It makes sense because that language is the same when we're used to dealing with the machine, but if we're crossing over or bringing from now I'm not using a V60 to I am using a V60, yeah.
You probably just need to have a title on your bit and adjust according to what gives you the most.
Always a great way to do it, for sure, yeah. And understand kind of what your target is and look at that. And that's a lot of times what I'll do is I'll come in and do an SIMB thing or something and non-invasive.
Make sure it's out of the breathing circuit.
Oh,
Okay.
we said it if they just need CPAP.
So if we just need a CPAP, I would go into your spontaneous mode. So I
We
would
just
do
did it on your purge.
spontaneous
When else should you do this? When you're doing your
and
previous
just do
step?
CPAP. Just have zero pressure support.
It's a zero pressure.
So this
Yeah,
would be more
and they should
troubleshooting.
do a PEEP of
Hey,
5.
I've got NO2.
Yeah, I really wish we had CPAP in the adult mode. In the neonatal mode, you have CPAP as a mode. It's really awesome. But that only goes up to 7 kilograms.
So let's go ahead and do a previous checkout. If anybody wants to run through this and push some buttons for me.
Anything else?
Anybody new to?
Any other questions at all?
Kind of walk you through. Thanks. So,
What?
I keep asking this question and I never don't get to use it in time. but-
so connect the
but
injector
on the
module
trending
cable
mode,
and tubing to the
how do you
injector
adjust the
module in
time bar?
Dynamex DSIR. So this is our.
I can't always get the window
Our
I want.
injector module.
Really great question, and yes, it gets kind of confusing. There's a short video on that we have that I can send the link to Christy later on, you can see. But still, it's a difficult one. So once we get into trending,
We're ready for the next step.
we're talking about the time bar here.
Load 2 Dynamex cylinders.
So
into the cart, check
when you
cylinder
select the time bar, so if
Look at
we,
those barcodes down below.
What?
Just make sure I don't have an expired.
oh, sorry,
date.
sorry. I'm
This
only
one is December
Yeah.
2025, so I know
So
this is good.
once we're here, we can select a few different things. Gosh, there's nothing in here, so it makes it tough.
Yep. Yep.
So if I select this one of the dashed lines, there's another select I can make
Got
up
our
here.
regulator over here.
When I select this, you'll see this bar down here getting bigger and smaller. That's how you select how to kind of zoom in, basically. And so as I turn this all the way up to get all of the range, right? So that entire 72 hours of snapshot of data,
Yep.
or I can shorten it down in one day. I think that's like 8 or 12 hours or something like that. So you can shorten it based on that little bar there if you select this
Connect
one
idle
here.
blender inlet hose to IMAX
Again,
DSI
clear about his mud,
outlet.
but if you have enough data on there from one of your patients to play with, the next time you have a patient get on the vent for 3 or 4 or 5 days,
We're just making sure that's
just go and
connected
do
to the
that,
right
select
covers.
that, dial that in, you can kind of see that it'll pull up a window of, oh, now this is just a window of 12
Connect
hours.
high pressure O2 hose to the back of
It's
the
easier
idle
to see
blender.
some of that data,
That
the
is our
small
backup
fine points.
system here, so we want to make sure that our high pressure O2 is connected in the back.
Yeah, good question. I like the
And, of
trending
course, to our O2
technology or capability,
gas
but there's a
source,
lot
which we've got
going
right
on,
here.
so it can get a little confusing.
Confirm the IMAX DSIR cart infrared cable or transport regulator cap assembly is
Nothing?
connected to IMAX
Good?
DSIR infrared cable inlet. So let's just say,
That was easy.
that's that black.
Awesome.
Because we're all pros. Everybody
wanna
will be
make
using
sure that
980,
two-way
not a
communication-
V60.
That's right.
And I see
Try it.
Yeah,
And I see there's no reason not to.
yeah, and I think that's the
It
thing
would've
that
been a
we
lot
need
easier
to,
the other day for me.
if you just
I
start
would've just
trying
swapped.
it, and then
Okay,
reach
so
out with
my
questions and
initial
work through it. It's gonna be a
connection, so
process.
step one,
It's gonna take you guys time. It's